All right, this is an open chain exercise. The leg press was a closed chain exercise because once again, the foot is planted and the body's moving on the foot, therefore it's closed chain. Right now the body's planted and the feet are moving onto the body. That's open chain. It's more of an isolating exercise. So that one, the leg press worked out the quads, the glutes, the hamstrings. This one, since you're isolating one movement, you're working out straight up quads. Be careful on anybody with an ACL that you don't add too much of this. The therapist will show you how to do this and really will pay attention to this specifically with ACL patients. But this is a quad exercise. The way you set this up, person sits in, so their knees line up with this. Important factor with the seat, you don't want the seat too far up where they're too flexed here. You don't want 90 degrees here. You actually want about 110 degrees of trunk flexion, so they're leaning back a little bit. This thing, you would do it for them, but I'll do it myself. Down like this. You put it right on top of their ankle joint. All right, they dorsiflex to keep this up, or else it's going to slide down to the top of their toes, which is what you don't want. So they dorsiflex up to keep it and maintain it up like this. In Bethpage, I know it's a lot tighter, so just stay like that. So from here, the person starts. There's a towel underneath. Again, because this pad is very, very tight. And if the person's doing this because they have a hamstring strain, you want to keep the towel on there for that extra cushion. And again, so you start from the base here and go up towards the muscle. I'm having it stick out a little bit so you can visually see it, but it will be tucked under more. So from here, they go straight up. They got to lock out the knees, okay? Same thing as all the other TKEs, the knee extensions we've done. You have to lock out the knees. That's full range of motion, okay? You wouldn't do a bicep curl and stop here. You'd get all the way here. You wouldn't do a tricep extension and stop here. You get all the way down. So same thing here, all the way up, back down, right before the weights touch, and back up. So visually, when your knees lock out, that's when you're done. Straighten them out as much as you can. When you're going back down, right before the weights touch, or when they feel a nice amount of stretch here, go right back up again. That's why you as the the Aide, you really want to take this and you want to push their knee in comfortably so they're starting in a position where that muscle is really stretched and it's in a position where they're going to get a workout. If you don't put this down, let's say they're starting from here and they come down, the weights clank, well, you're losing this much range of motion of the muscle really working. So go all the way up, go all the way down. If we were going to do single left, let's say, again, same thing as before. We want to start with both legs going up. The right leg drops down. The left leg wants to come down. Right before it hits the other shin, my right shin, go right back up. So I lock out the knee, come back down, hit the other shin, right back up. And it has to lock out. If it's not locking out, then it's a problem. If the person's sitting up too far with this thing, it's going to be harder for them to lock this knee out. So really have them leaning back a little bit, that much extra, to put the quad muscle in a better position to create force to lock out the knee. And then, of course, you want to help the person out like this, and that's how they get out. All right, so that was knee extension and then a single left knee extension. All right, so now we're going to go to mini squats at the table. Again, you try to get an older population stronger, somebody had a surgery, you try to just get the knees used to squatting. A lot of times doctors are like, don't squat, because people don't know how to squat, so they think patients just shouldn't squat. Basic rule of squats is don't let the knees go beyond the toes. Pretend like there's a line from here going straight up, and the knees can't touch it, all right? Like a force field, if you will. So the knees are going to bend a little bit, but then the rest of the motion from the squat comes from the hips, down and back up. There's really no pressure on the knees when you do it that way, all right? There's a lot of pressure on the quad muscles and on the glutes, which is where you want it. So we'll roll this up so you can see it, but that's pretty much what you want. So the person's going to stand here, older population, put a chair here so they have something to sit on. God forbid they lose their grip and they fall or whatever. Their hands should just be here as balance. They shouldn't be pulling on this. You know, they shouldn't really be pushing on this, because this could happen and this could happen. So their hands, again, are for balance only and just to hold on a little bit. So if you see them, see the hands turning white because they're really gripping, you got to tell them, listen, don't rely on your hands. They're just there for extra balance. Eventually you want to do it where their hands are hovering over and then going down and up. So weight is on the heels, okay? The chair is right back, right behind their heels, and from here, they're looking at the chair, they're gonna drive their butt back into the chair right before they sit down, and then back up again, okay? So the knees bend a little bit, but then the rest of the motion comes from the hips, down, 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 back up. If you look at my toes right now, they're almost doing this, which is what I want. My weight is on my heels. I'm not doing this. Look at my toes. I'm not doing this. This is no good. This puts a lot of pressure on my knees. Even me doing this right now, I feel it in my knees. Weight on my heels takes the pressure off my knees, down and back up. Again, my hands are just holding on. I'm not leaning back and holding on with my hands. That's how you fall. You can even hit this chair and then fall backwards. So they got to sit down. They can look down a couple times to see where they're going, but otherwise you want their head looking straight. Where now they have their form, they go back up. They can do it where they're facing the mirror. They can look at themselves in the mirror, see if they're doing it correctly. But you see my back is straight, and it's coming from my my hips and my thigh muscles. All right. Eventually, with a younger population, you can take the chair away. But older people, when they do it, they can sit down, they can rest a little bit, take a load off, and then start it again. So that's your mini squats at the table, number 175. All right, so the next one is, we already went through it, which was exercise number 126, which is in the glute section, the lunges, 125, the lunges, the single leg to bilateral squats. Again, lunges real quick, one leg in front, one leg behind, hands here, let's say this was up to here, drop straight down, go back up, pushing through the heel, on the toes in the back, coming down, going back up. That's lunges. If you wanted to do a single leg squat, you could do it this way. I'm just gonna use this so you can see, but half on, half off. You could hold on to here. The other leg is bent, down, back up. You don't want the knee to jut in, so I'll show you from this angle. I'm making sure my knee doesn't go beyond my toes. That's wrong. So I can watch that in the mirror, and I can look straight down. And I wanna go, you can hold on to here, straight down. You don't want the knee to go in like that. So the knee has to stay right in line with the toe. Visually speaking, that's how you explain it to the patient. And then they just drive straight back right before the other foot touches, and then they come back up. Very, very hard exercise to do, especially if somebody's trying to get back into it. So this is a one-legged, squat. We're gonna progress to the bilateral squats. We showed you again with the ball, but if you want to do a goblet squat, hold it like this. Knees are separate, okay? Shoulder width, take a step out. That's the rule. Straight leg deadlift, squats, that's always the rule. Shoulder width, step out. Weight is right underneath the chin, straight down, come down, and go right back up, okay? Toes can be out a little bit. Some people's hips, if their toes are straight, that means they're lined up in a neutral hip. It might aggravate it, get a pinch in here. The moment they do this a little bit, it might open up the hip a little bit and allow them to go straight down even more without feeling this pinch here. Whereas this might aggravate their hip, this won't. And they get that much lower, get that much more glute work. This is right underneath here, down, straight up, weights on my heels. The mat underneath my toes is helping to push the weight onto my heels. Again, same rules apply. The knees don't go beyond the toes, back is straight, come down, go right back up. I never lose the arch in my lower back. That's providing the stability. Down and back up. So there's your goblet squats. Okay guys, we're gonna move on. This is either like number 178 or 179. It's squats, so we just did goblet squats before. Regular squats with the barbell, same kind of rules for squats. You wanna have these down here for safety measures, so see how far low the person can go, and then have these a little bit lower. So if they, God forbid, ever need it, they could just kind of rest it and get out of there. We shouldn't be really using so much weight that the person is gonna collapse, but make sure that these are slightly lower than the person's shoulders, because the way they're gonna do it is they're gonna put their hands here, they're gonna go under it, right underneath it. You never wanna pick the bar up from here. Have your hips right underneath the bar, make sure it's centered, right? So you can look in the mirror, make sure you don't have like the bar over here, so it's right in the center of your neck. Okay, it's gonna rest on the back of your shoulder blades, not on your neck like this, but on the top of your shoulder blades. Okay, there's a little shelf there. You pick the bar up, take a step back, spread your feet out. You never wanna look down, because where your head goes, your body goes. So, spread your feet. Some people will have to point their toes out a little bit, which is fine. What you wanna do from here is shoulders, dip forward a little bit, the knees bend slightly, and then the rest comes from the hips. Come down, down, down. My weight is on my heels. You can actually see my toes coming up. Weight's on my heels, shoulders come forward, knees arm forward, arched is the lower back. And what you don't want to see is going down too low that the hips start to, what they call that butt wink, where it starts to tilt posteriorly. You want to always keep that arch in your lower back. Weight on the heels, drive through the heels and come on up. All right? You don't want to see this, and you don't want to see this. Much of the motion comes from the hips. Down and up. You can have the person watch their shoulders in relation to their hips and make sure that they're not going more to one side than the other. So this way would be that the left side, I feel, is strong. I'm really overcompensating it, but you don't want the person leaning over. You want them to go straight down, straight up. And when they're finished, they bring their feet in, they walk it in until it hits, and they watch, and before they go away, they visually look. It's in, it's in. They take one step back, and they're out. All right? Squats with barbell. All right, so we're progressing to, instead of just doing regular leg press, we're going to do leg press plyometric jumps. Plyometrics is when you ask the joint, whether it's upper or lower, or your explosive movements. So it's a, more end of the therapy kind of line right before the person gets discharged to make sure that they're pretty much ready for sport if they're getting back to any kind of recreational activities like that. So plyometric jumps, usually lower weight than what they used to. What you want to start with, you want to bring this thing all the way down, and then you start bringing it up. So if they're going to do single left, you come down, up, then they land, they come down again. Up, the whole time they're watching their foot. Typically, so in slow motion, you go up, and then as you come back down, the calf first grabs, so you lower it down with the calf, and then the quad kicks in, and then you hip. But it all happens like that. So up, down, up, and then you don't want it down here where now you're causing too much bend in the knee. You want to still land, and when you come down, you're landing and you keep meeting this 90 degrees in here. And you come down, you sink into it, you go back up again. So it's a very good exercise to prepare somebody for sport where they have jumping activities, where they have to jump and then land back down. And again, you start with the thing all the way low, but you never really get this low. You can to make it harder, but sometimes that happens too. That's okay. It might be that the weight is too light. All right, so that's plyometric jumps. All right, so the next one's going to be box jumps. Now we could use those stepper things that we have down there for the person to jump on. Higher level, you want to jump from here up to there. Again, somebody who's getting ready back to go to sports. And you could do a one-legged, which I'm probably not even going to try to attempt, but that'd be awesome to do. One-legged would probably be more realistic on that thing, but so same way, like you're going to go into a squat, all right? Come down, and you want to explode out. Come up and land. Then come down and land. Okay? So, up, down. You can bring your arms into it. You know what? If you want, you can make it harder and just keep the arms out in front, which is harder. Come down. If they lean forward too much, you got to remind them to get back on their heels. Up, down. Okay? Box jumps. Next one's split lunge. It's a little bit harder, a little less base support. You're on your toe. You're a little bit more flexed back here, or extended, I mean. So, just grab a weight, come down, come straight up, down, come straight up. That's that. You also can do a plyometric split lunge, which, if I did it right here, again, you're exploding out, switching legs, coming back down. So their hands are down here. You can eventually go to holding some light dumbbells. You come down, split, 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 split. All right, it's a very dynamic exercise. I think we showed it earlier, but again, it's a good reminder for you. So now we're done with the quad stuff. We're gonna go, thank God, we're gonna bring it back to easier stuff. We're gonna do calf now, okay? Calf stretch. Early on, before the person's able to be weight bearing, you wanna give them a calf stretch. So before we do pro stretch, which we're gonna show you next, just kind of lean forward, person grabs it, keeps their knee straight, and you just basically pull back. If they start to feel like sharp neurological symptoms, you might be getting that nerve being taut first, so that the knee can be bent a little bit, and you can stretch out the calf this way without the nerve getting tight. So you basically want to hold it for a good 30 seconds, take a good rest, about maybe another 10 seconds, and then do another one. You're not really stressing the muscle here other than stretching it, so you don't need to rest for a long time, but a good 30-second pull. See, my arms are straight. I'm not pulling with my arms. I'm just basically gently leaning back, holding a nice low, prolonged stretch. Person should feel it here. If they do feel it here, let the therapist know they may need to do some manual work in here to loosen this up. Pretty much nice, gentle calf stretch. Seated strap, with the strap. Pro stretch, I've seen some people do this. put their heel in, and they just stand up and they take the other foot away. It's not meant to be that way. You could roll and really hurt yourself. So if you see somebody taking their other ankle off, remind them not to. All right, typically it's done in here where they can have these kind of things to hold on to, but I'm gonna just show you here. The other leg, you can see is still down. I'm not picking it up. It's down like this. I basically take my heel on this side and just drive it into the ground, lock out the knee, and I just bring my center of gravity forward a little bit, and you feel a nice pull in that calf. I see why people would want to do this. You feel like you get a little better stretch at it, but it's still, try to tell people not to do it. Sometimes people do this, and they hold on, you know, in here, and they really just pull on these two. Just judge it with the person that's doing it. If they look like they're a spaz and they can't really, you know, be trusted to do this, don't do it. But I guess if they want to just keep their tippy toe down on this leg, it's okay to put, you know, 99% of the weight on this leg. In case something happens where they got to quickly get off this leg, at least this other toe is down, they can quickly put weight on it. But there's your pro stretch. Again, good 30-second hold 3 times. 184, we're up to seated, plantar flexor stretch, knee flexed. So the knee's gonna be bent. The calf is made up of the gastroc, which crosses the knee, and the soleus, which does not cross the knee. Together they form a nice thick tendon called the Achilles, which helps to plantar flex the ankle. So over here, let's say we wanna just stretch out the ankle or the soleus, and we wanna just get more dorsiflexion without the calf stopping us. We put the calf on a little bit of slack here by bending the knee, and then literally just try to lean forward and allow for more plantar flexion. Once the heel lifts, then we've lost. So you want to keep the heel down and just basically gently bring your knee forward, forward, forward. You're not weight bearing on it, so it's not going to hurt the knee. Otherwise, my knee would be here, but I don't want to block it. So you just lean forward, heel stays down, and you feel nice tension in here, and it's a good stretch just for the ankle to get into dorsiflexion, which is toes up towards you. And it's a good way to stretch out the soleus muscle here, because the only thing that it crosses is the ankle. So again, we shorten the calf, the gastroc, by bending the knee, so now we're only stretching the soleus muscle. Big goal is to keep the heel down. Again, a good 30-second stretch, really lean into it, and then you can come out of it 3 times. Okay, number 185, it's a standing heel drop on the platform. They basically put their foot here, make sure they're not only putting their toes so they slide off. Get a good amount of the forefoot on there. You can do both feet. You just take one away. You can hold on here. Just let the heel drop. If you feel like it's coming up a little bit too much, you could, as an aid, take a dumbbell, put it right here so it doesn't move. Then the person can just drop their heel straight down. And again, they're just letting the heel drop, getting a good pull in the back of that calf, which is right here. And once they're done, they can come on off. But it's a good exercise, good stretch to do. You could also do it in the front, you know, put the dumbbell in the front here, just let the heel drop straight down, pretty self-explanatory. Nice pull in the back of the calf, shouldn't be any pain in the ankle or in the knee or anything like that. You definitely have something to hold on to. The other leg's available. If they need to quickly get off, they can put their weight back down. Now we're getting into the ankle thorax. Like we always do, we start out with something very easy and we go into harder and harder. So the first thing you're gonna do is pretend like somebody just had an ankle fracture or surgery, and you wanna just get the ankle moving. So what you do is ankle pumps, active range of motion, AROM. You go up and down, you just pump the ankle out. Why do I have it elevated? Because that's pretty much gonna be a swollen ankle most of the time we do this on somebody who just had surgery or been inactive. It's just gonna be very swollen, so you wanna have some kind of elevation. You might be able to take a thick pillow and put it underneath this half moon to even get it higher. But pretty much you want it elevated, go up and down, pretty self-explanatory. You do it for like a minute or 2, that'll be the exercise, it's not like a reps. You can do, or you want to say, hey, 60 times of the ankle being pumped up to you. Ankle pump, every time you do it, you're getting, more of the swelling out of it. We're going to progress to the next exercise, number 187, which is alphabets. Basically, pretend like you have a pen in between your toes. You just write the alphabet. So A, B, C, and you go all the way through the alphabet. D, and handwriting doesn't matter because it's imaginary. So you're just basically moving your ankle around in different movements and just getting the coordination back to it. All right, so number 188 is dorsiflexion. AAROM is active assisted, but we're not really, we're just doing active range of motion. So if on my left leg, if it just says AROM, it's pretty much what I showed you before, but this would just be what it looks like. You'd set it up this way, and the person would just go up and down, and just get, 3 sets of 15, 3 sets of 20, just to get it going if the therapist doesn't feel that the person's ready for any kind of resistance. If you see it with the T-band, when you look at the ankle on the right, just look at the way it was set up. The person slides all the way over to the right side. You see how the band is set up? All right, you always want some kind of tension on there. It's around the toes. It's not on the tip of the toes, but on the forefoot, just like it is. And again, the person, you don't want them like this on an angle. You want them in line. So they would slide over, you would slide the thing over, and you see how the bolster is not touching my heel. All right, you don't want this, where if the person comes down, their foot is touching the heel is touching the bolster. You want to be able to get the full range of motion into plantar flexion so you can work from there and come back up. You also want this bolster underneath the knee, and you want to reiterate to the person, reinforce them pushing down on this thing. A lot of times people, as they bring this up, they do this, they hip flex, which you don't want. You want this going down, especially for people that have knee issues and their knees can't straighten out. Doing this little bit of a quad set where you push down into this bolster also helps to reinforce that knee locking out position, which is what we want for normal ambulation and function. So the knee pushes down, you hold it from here, you come up all the way till you feel nice tension in the back of the calf, in the Achilles as well, and then you come back down nice and slow. If the person starts to get pain here, no good, or if they feel like the muscle's working here, that's okay, but if pain in the top of the ankle or the joint, no good. If they start to feel, let's say in between sets, they're just hanging out like this, there's some tension going on right here, so they might be uncomfortable, so you'd walk over and take the band off in between sets while the person's resting. If they're okay with it, they can just kind of hang out, and then from here, just go up and down. Many times this exercise is given for people that have tight calves and you want to just loosen them up using reciprocal inhibition. Sometimes people just have weakness, but once you get to the black, it's, you don't really need a lot of strength in your anterior tibialis to, allow the heel to hit and then lower your foot down. So this is becomes like a calf stretching exercise by doing this. So just think about it like that. So that's dorsiflexion, active range of motion, and then with the T-band. So the inversion, active range of motion on the right ankle, we just go like this, in, again, very simple, in if the therapist doesn't think that they should have resistance. Then when we progress to with the black on the left ankle, basically you want to have the person, we sometimes have people just holding onto their legs because they start to do this. And it's not a rotation of the hip exercise, it's the ankle and the knee. The knee has to stay stable, the hip has to stay stable, and then the ankle just works. So we hold it here, you always say kneecap point straight up, and then from here you allow the TheraBand to bring the person out, and then they point straight in. Note the way she set it up, it's behind the post, not in front, because it can go off the corner of the table, which you don't want, and then you have no resistance at all. So you always want it to have behind the post, coming straight up, and again, some kind of tension. The person can be in the middle of the table. I'm over to the right because I did the dorsiflexion just now, but I could stay here. It's about where the ankle is. Go straight in, ease it on the way out. It should not do this. It's not that. It's nice and slow on the way in, ease it out slow. And the person will feel it in here slightly, but again, should be no pain. That's where the muscles that you work in the posterior tibialis. So that's inversion active, inversion with the T-band. Okay, so now we're going to do eversion. Just note that the TheraBand switched. It went from this side to that side. Because eversion, I want to fight to get this way, so the resistance should be pulling me this way. Just like inversion was just pulling me that way, and I was fighting to go in. So, right ankle, active range of motion. Again, if the therapist doesn't feel like the person is ready for it, the person just goes eversion like that. Okay, they can also, you can make it into an eversion exercise, so the person's not wasting their time, meaning they can go all the way in, all the way out, so you knock out 2 birds with 1 stone if you're doing just active range of motion. But if you're doing it with the resistance, you see again, she put the band behind the post, not in front of the post, and from here, the person's ankle starts in and out. Don't ever just put the band on and let it go. Put the band on, ease it, just ease your hand away so the person feels the resistance and they can gradually take on the resistance with their ankle. If you just put it on and let go, and it throws the person's ankle in, if they have any kind of ligamentous issue out here, you might inflame the hell out of that and cause a person to be in a lot of pain and be very mad at you. So just put the T-band on while they're, ankles like this. Tell them that you're going to slowly take your hand away and they're going to have to brace and hold the resistance themselves. So the band brings them in, then they go out. You have a lot more motion, look at my right ankle, going into inversion compared to eversion. That's because of the anatomy. The bone on the inside of the ankle stops here, bone on the outside of the ankle stops here. So when you're trying to go to eversion, bone actually hits bone. When you try to go inversion, the bone has a little bit more room to go because this bone's a little higher. So a little anatomy for you. So they start from here, they go out, they allow themselves eased back in. Again, you're not here and you're letting it fly back in. Okay? Out here, nice and slow on the way back in, and they'll feel it out here. You're working the peroneal muscles out here. Again, no pain should happen, and, it should be at the ankle at all when you're doing this exercise. All right, number 191 is plantar flexion first on the left. Again, PT is not ready for it, so they just, doesn't want them to do it, so they just basically go down. You can also make this an active range of motion of dorsiflexion, plantar flexion if we just want range of motion. Very similar to the ankle pumps we showed you before. Person could do these at home. Once we're going into doing it with the resistance, what you want the person to do, never grab it here, because if it flies off my foot, it can hit me right in the eye, poke my eye out, so you want to bring it here to the belly, so if it slides up, it just hits me in the belly. You'll always want a good amount of tension on here, so the person grabs it, pins it against their leg, and keeps it here, and then from here, they point down, ease it up slow. You just tell them, push down on the gas pedal, down, ease it up slow. They should feel it in the calf working. They shouldn't feel any pain. If they have pain, same rules, just let the therapist know. 0 is nothing, 10 is severe. Anything from like a 0 to a 2 or a 3 that's not getting worse is okay. But if they're doing this and it's getting worse and worse as they're doing it, that's not okay. So down all the way. And what you want to do with all these exercises, when we're doing dorsiflexion, inversion, eversion, you always want to do no resistance first. Have the person do as much range of motion as they can, and then make sure that they're getting to this range of motion with resistance, like every other exercise. So if I get to here, even with my other foot, right? But then when I put the band on, I only get to here. Well, that's not as much as I have without resistance, right? So you want to make sure that you loosen the resistance so the person can get the full range of motion. So whatever range of motion they have to be strengthened in that range of motion. They can't do, less range of motion because you're giving them more weight. It's not about the weight first, it's about the form, and the form includes the range. So down, ease it up slow. So now we're gonna go to standing bilateral calf raises, number 192. So the person stands here. Again, just like the stretch I showed you before, they come down, I go straight up. I'm just holding on, I'm not pulling myself up, just for balance. Pull straight up, slow back down. All the way up, slow back down. You want to start giving them a resistance, you can, but you want to make sure that they're still going all the way up. You can do this single, right? So again, they go all the way up. You want to see if the left one goes all the way up. If like on my left one I only get up this high, but on the right one I get up higher, that's a problem. So you want to stand behind the person and see how high the heels go, and then let the therapist know, hey listen, on one side his heel gets up high. They may not be ready for this, so we have to go to something lighter like a leg press or something like that. All right?